Hello, my name is Jacob Williams. Today I'm going to be performing my skills video for IM injections. I'll be using my general principles and safety practices. I would start by gathering my supplies, which I've already done. So I would knock on the door, would enter the room, shut the door behind me, providing privacy. I would check to make sure that the medicine is correct, using my 11 rights and 3 checks. I would identify myself to the patient. I would explain the procedure that I'm going to perform. I would ask for 2 patient identifiers, checking to make sure that the 2 patient identifiers match on the bracelet that they provided me. At this point, everything checks out, so I would move on to performing hand hygiene and then putting on gloves. At this point, I would assess the area that I'm going to give the shot in for any edema, any bruising, discoloration. Make sure that the area is good for the shot. You can use a 18 gauge to a 25 gauge needle, 5/8 inch to 1.5 inches, depending on the age and location that you're giving it. Today I will be using a 23 gauge 1 inch needle to give my shot. At this point, I would take a alcohol swab and clean the top of the bottle in a circular motion. I would let that air dry. While that's drying, I would go ahead and open my needle, pull it out, would uncap it. I would draw up 1 milliliter of air. I would go ahead and inject that into a vial to displace it. And then I would draw up 1 milliliter of fluid without touching the plunger. I would then get all the air bubbles out of it. And I would scoop my cap up to recap it. The only time you can recap is when you haven't injected a patient. I'm going to then take a new alcohol swab and clean the injection site, starting at the injection site, working my way outwards in a circular motion, letting that air dry, not fanning or blowing on it. Once that is air dried, I would then uncap my needle and inject at a 90-degree angle, making sure that it goes all the way down. Slowly inject the fluid into the skin, quickly removing the needle, engaging my safety, and putting it in the sharps container, taking a gauze pad and putting it on the wound, making sure not to massage or it. I would then report and record, perform hand hygiene, and check back on my patient to make sure that there is no reaction.